Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I have to just tell everybody that we have a lot of physicians on our show, and sometimes the discussion is very common. I mean, we may have orthopedic surgeons, we may have plastic surgeons, we have gynecologists, we have lots of people. The one reason I'm very glad that Dr. Gashti is on our show now, and he's over there practicing at West Boca Medical Center, is that his specialty is vascular surgery, and it sounds like, oh my goodness, it's all to do with the veins. But I'd like you to go through what it actually is, because we all have veins. We have small veins, larger veins, big veins, and tell us what you do and how, what the seriousness is of the very large veins compared to just the spider veins.
Sure. Well, the cardiovascular system, consists of a very complicated system of arteries, veins, and lymphatics. So it's not just veins. We have arteries that are very important as well. So just to be clear, arteries carry blood away from your heart. So the heart pumps, and arteries carry blood to all over our bodies, every organ. And veins, in turn, have to carry that blood back to your heart. So that's what the circulation is. The blood just circulates because of these two systems. And they're very complicated. Veins, when we talk about veins, the majority of complaints are related to the veins don't look good. The large veins in our legs, they look ugly. So varicose veins, spider veins, these are all a sign of what we call venous insufficiency. So the veins in our legs are not working the way they should. The valves are not competent. And therefore, the vein blood doesn't return completely to our heart. And it just accumulates in our legs. And for the veins to accommodate for that excess blood, they just gradually need to get bigger and bigger. And that's what varicose veins are. And spider veins are a precursor to developing varicose veins.
Well, it's interesting, but years ago, I remember I had some spider veins on my face. And I went to, I don't remember the kind of a person it was, a surgeon, maybe a plastic surgeon, and they just did a tiny little needle, and it didn't really hurt, and they were gone.
Yeah, so you probably had what we call sclerotherapy, and that's how we treat these smaller veins, what are called spider veins, or the medical term for them will be telangiectasias, and that's how we treat them. We treat them with sclerotherapy, but you can also laser them now, so you don't have to worry about these tiny needles going through your skin and into the vein. You can just laser them right through your skin, but these are only effective for smaller veins, not the larger ones. The larger ones you may need to remove, and then you also need to find out whether you have reflux in those veins, because if you do have reflux, then you have to treat the reflux before the veins get better. You can keep taking these veins out, but if you don't treat the underlying problem, they tend to return.
Now, tell me something. Years ago, I thought that when people had serious vein problems, and they went to a doctor and they had bandages on their legs, and it took them days to recover. But now, I don't think it's that hard, is it?
No. I think what you're referring to is a procedure we used to do is called the vein stripping.
Yeah, that's right, vein stripping.
Right, and also what's called phlebectomy. What that means is the larger branches, we make little incisions and remove them. But nowadays, we are a lot kinder and gentler. It really is just a needle into the vein, just one needle, and through that needle, we have either a laser catheter or a radio frequency catheter that we can treat the entire length of that vein through that needle puncture. There's really no incision. There's no. There may be one Band-Aid on that site, but we don't strip veins anymore. We still sometimes have to do phlebectomy to remove some of these larger veins. But as far as the main vein is concerned, is just done through these minimally invasive techniques.
So when people have problems with large veins, what do they complain of? Their legs hurt. How serious are they?
Well, yeah, I mean, mostly people complain about the way they look, but when they get really bad, and if you do have the reflux that we talked about earlier, then your legs tend to swell up, especially when you're up and around and your legs are in a dependent position. After you walk for an hour or so, or you're up on your feet for an hour or so at work or whatever it is you're doing, your legs just feel so heavy, and you feel like you're dragging your legs. And it becomes quite uncomfortable, and you have this almost bursting pressure in your leg because your leg is just swollen so bad. And again, that's because that vein blood is not returning from your legs. So most of the time, the symptoms are related to increased pressure in your leg because of the swelling. And if it is not treated, then all of this can lead to what we call venous status ulcers. You can develop ulcers around your ankles. And then that is just very difficult to treat. So the key is to prevent it in the first place.
Well, wow, this is a lot of new information that people are hearing. My guest is it Dr. SEYED Gashti? Did I pronounce SEYED correctly?
Correct.
And he is a vascular surgeon over there practicing at West Boca Medical Center. And if you want to get in touch with him and have an appointment, his phone number is 561-483-3989. That's 483-3989. And I would assume, Dr. Gashti, that it's better to take care of these before they get very large. Is that not true?
That is very true. I mean, the treatment most of the time is very simple. You need to, make sure you're elevating your legs, so you use gravity to your advantage to drain your leg. You can wear compression stockings. So yeah, it's easier to treat these things early on before you start having sores and discoloration of your skin and things like that, because a lot of these conditions are not reversible. Once your skin discolors because of the iron in your blood, that is not going to reverse. So it is better to seek help and treat this earlier rather than later.
So are men or women more prone to this disease?
Actually, women are. We're not quite sure whether it is just because women tend to go and get these treated more than men. And men would just sometimes, they're hard-headed and they think, oh, this is just normal. I'm not going to go see anybody about veins.
Right.
So they may not go seek help, but women tend to be more conscious of these sort of things. But I think overall, the condition is more common in women than men.
Could that be because of pregnancy?
Pregnancy has some effect because when the uterus is gravid, as it gets larger, it compresses the veins in our pelvis, and that can sort of cause backup of the venous blood, so it doesn't return to your heart the way it should, and therefore it causes varicosity. But also there may be an effect from estrogen, hormonal effect, which obviously is a hormone more prominent in women than men. But that may have an effect on this as well.
I see. So when you were going to medical school and you could have been have any kind of a specialty, why did you choose to be a vascular surgeon?
Oh, vascular surgery has been going through a whole lot of really amazing changes. We do some tremendous surgeries now through little tiny incisions. Most of the work that I do, at least 60%, is what's called endovascular. It's all through little tiny incisions, if any incision at all, and it's all done by wires and catheters. Patients go home most of the time the same day or the next day. For example, when we do thoracic aneurysm, it used to be that patient stayed in the hospital for at least 2 weeks with huge incisions. I just did one last week at West Boca, and the patient went home the next day with about an inch incision in her groin, and that was it. So, yeah, vascular surgery, the technology, the advances are just amazing, and most of it is for patient care and for their comfort. They go home earlier, they go back to work earlier. So it's a very growing specialty. And I really, truly, I tell my residents and my students, I don't know why anybody would want to do anything but vascular surgery these days, because it's just an amazing specialty. Of course, I'm a little bit biased.
No, but you're very
enthusiastic.
You're very enthusiastic. It's a pleasure to talk to you. So let's talk about those stockings. We all see them. Now they're in all sorts of colors. Tell us what they do and all about them.
Yeah, so the real compression stockings are graduated. So what that means is that the pressure around your ankles is going to be much higher. And as you come up towards your knee, the pressure gradually decreases because that vein pressure around your ankle is much higher. So you want to have more pressure there so that the stocking can squeeze the blood out of those veins, get them out of there, and get them to where they belong, which is your heart. So that's what the stockings do, and that's why they're so important. So if you're up and around, if you know you're going to be up and around, and you have this condition, it is just very important that you put on those stockings.
Well, I stand at my computer. I have one of those sit-stand desks, and someone once told me that I should be wearing, if I stand there for more than 3-4 hours, I should be using those stockings. Is that true? Even though I don't seem to have a problem with my legs, but maybe one could start.
Yeah, I mean, I when I know I have long surgeries, 5, 6, 7 hour surgeries, I wear my stockings. I have them here in my office, and I put them on, because if I don't, by the end of the surgery, I see a whole lot of swelling around my ankle, and I don't have venous insufficiency, but I know if I don't do this, at some point I will have those veins.
You know, it's interesting you should say that. I'm very careful in what I eat and I exercise, but when I'm standing a long time, I do see that my ankles, where those bones are, the bones are a little bit now not as vision. I can't see them, and that's what's happening?
That's exactly what's happening. Again, because fluid, and blood is fluid tends to settle down, right? I mean, fluid doesn't float, it just settles down. So it goes to the most dependent part of our bodies. And if we are standing, our feet and ankles are the most dependent part of our body. So you should expect some swelling of your legs if you're up and around for long periods of time. But if you have this condition with your veins, then you get swelling that is not normal. And that's when you really should wear these stockings so you don't get to those later stages of this condition.
Well, let's talk about when we fly in the air, not by ourselves, but on an airplane. I've been told that you shouldn't really, after an hour, you should get up and walk around. And is that to do with the vascular system?
Yeah, well, that is because if we don't get up and walk around, if we just sit for, some of these flights nowadays are, 12, 14 hours. What happens is not only your legs will swell up, but more importantly, you're at risk of forming what we call DVT, or deep vein thrombosis. If the blood isn't moving, if I took some blood and just left it on my desk, is going to coagulate. It's going to form blood clots. So if you're not moving and the blood in your vein is just stationary, which it can be, then it can form blood clots. And that's what's called a DVT, a deep vein thrombosis. And at 36,000 feet, you do not want to have a DVT because these blood clots tend to break off. And if they do, they travel to our heart and to our lungs. We can have pulmonary embolism. And about 200,000 people die every year from pulmonary embolism, not because they're flying, but because they form blood clots and they break off and travel to their heart and to their lungs. So if you're going to be stationary and you're not moving the muscles of your legs, then you should wear your stocking. You should get up and move around, because when we walk, as the muscles in our legs expand and contract, that's the pumping action to move that blood out of our legs. If we are sitting in an airplane and we're not walking around, that's not happening, and you're at rest.
Boy, thank you. Those were questions that I've been saving up. I didn't know who I was going to ask, but I'm glad that you were on the show. Dr. Syed Gashti, who is vascular surgeon at West Boca Medical Center, and we're talking all about the veins in your legs, and they're they can be very serious. They can cause other things, and you keep using the word. When someone has like GERD, or they have, what was the word you were using?
Oh, reflux.
Yeah, reflux. I thought reflux is just in your chest. Why are you talking about that with this?
Yeah. You can have peptic ulcer disease. You can have reflux in the stomach and esophagus, but this is the same mechanism because the veins in our legs, they have valves in them, and the valves are there so that as the blood moves up our legs, these valves should close to prevent blood from going the wrong direction, going back down, because that's what gravity tries to do all day long. So when these valves are incompetent, when they're not working well, then the blood refluxes, meaning instead of going up towards your heart, it actually goes down towards your legs, because that's what gravity does. It pulls it down. And that's when we call it reflux.
I see.
So it's the same mechanism as your stomach, but we're talking about the incompetent valves in your legs.
So is it good, if you're watching television, should you have your legs up rather than sitting in a chair? Or, I guess every chance you have, you should have your legs up.
Yeah, absolutely, especially if you look at your legs and you see you have some of these dilated veins or spider veins, then you have the condition. So the more you elevate your legs, the less the less blood is going to build up in these veins. So the veins don't get any larger. If you think you're going to sit down and read for 2 or 3 hours or watch TV for 2 or 3 hours, it makes a lot of sense to make sure you're elevating the legs.
Well, I have to say that I don't remember when I go to a family physician, primary care physician, that he ever says anything to me about my legs. Is that a common thing for a doctor to just automatically examine your legs?
Actually, it is not. There was just a recent study out there that primary care physicians, they're really not very versed in vascular disease. Not that they're not smart. Of course they are. They're all very good doctors. But that is not their specialty. So I don't know when the last time was that you went to your doctor and you had your legs exposed. I mean, everybody who comes to my office, they have their shoes off, their socks off, their pants off, because I need to look at their legs. So unless you look for this sort of thing, you're not going to find out about it. And if you don't know about it, then you're not going to tell your patients how to treat it.
Well, that's my next mission now, to tell doctors no matter what they are, even gynecologists. Look at the legs.
Well, you're going to get some strange looks.
And then if you have a problem, call Dr. Gashti and have some work done. So this has been a very, very good interview because it's not a common thing to hear a surgeon talk about, we've talked about some serious things and we've talked about other kinds of ways that people can help. But if you've removed, if you've worked on people's legs, will it come back again?
If you don't do the right thing, again, let me tell you this right now. For venous insufficiency and varicose veins and things like that, we do not have a cure for this condition. So all the things that we do is essentially treating the symptoms. So if we close a vein, if we laser it or sclerose it, that vein is going to go away. But if you don't do the right things with elevation and compression, you have a bunch of other veins, and they're going to get larger, and you're going to come back with varicose veins. So there is no cure for this condition. You just have to treat the symptoms.
And is it hereditary?
Hereditary is responsible for at least 70 to 75% of this condition.
Really?
So most patients in my office, when I ask them, they either have a mom that had the same thing, sisters or brothers who had the same thing, aunts. So, there's a significant genetic predisposition to this, and these things tend to run in families. When we're talking about veins, not necessarily the arteries, but this venous insufficiency and varicose veins, they run in families, absolutely.
And so that's a very important thing. So you have to take care of yourself. Now, so many people now are walking. I would think after our discussion, walking is very, very good for your legs.
Absolutely, and especially if you have this condition, because as I said earlier, as we walk, as we move our legs, the muscles expand and contract. And that's the pumping action to make that blood circulate, get out of your leg, and come back and get out of your leg. So walking is great, but if you're going to go out there and walk, just make sure you have your stocking on if you have venous insufficiency.
Oh, have the stockings. Aren't they hot?
They are, but and I know it is kind of hard to put them on here in Florida, but again, if you have significant venous disease, if you don't do this, then you're going to end up with venous ulcers that are just horrible. They're just so very difficult to treat. So you want to try and prevent it, and the way you do that is by wearing your stockings and elevating your legs. You don't have to wear them, every day. If you know you're only going to be out for half an hour, well, you may not want to wear those, and then when you get home, just put up your legs and elevate. But if you know you're going to be out there for a long time, going to be up and around, walking for several hours, you really should put these on.
Well, the other question, it's kind of a funny question, but when I've gone into medical supply houses, I see them, and now they're all colored, reds and greens and yellows. Isn't that kind of funny?
Well, it used to be that our patients complained that, they're so ugly, because we only had one color. It was that beige color.
Right.
And, a lot of patients complained about the way they looked. So, now they come in pink and blue and all different colors. They come with zippers. They're a little bit easier to put on. They come with Velcro, so you can just wrap them around your legs, because sometimes they're kind of hard to put on, especially if you have arthritis in your fingers. It's just difficult to put them on. But the manufacturers have tried to make it easier and kind of make them look a little bit nicer. So hopefully you won't have any excuses not to wear them.
And while we're talking about stockings, I think they're different degrees for different people. So if someone would come to you, would you give them a prescription for the right type of stocking rather than just going and buying anything that's there?
Of course. I mean, they come in different pressures. So the lowest would be 15 to 20 millimeters of mercury, but 20, 30, 30, 40. And then they come in different lengths. Some people only need knee-high. Others may need thigh-high. And some patients may even need the pantyhose type that go around the waist. So, yeah, they're all different sort of lengths, different pressures. It all depends on your symptoms, and based on your physical exam, then, of course, we have to prescribe the right ones.
This must be funny for you since you've been practicing a long time, and it's all evolved, hasn't it?
Oh, yeah, vascular surgery is just going through a whole evolution. Really, it has been going through an evolution for several years now. That is why it is so interesting.
Well, I have to thank you so much. You've been wonderful. I really enjoyed the interview, and I know that our listeners will love it. So thank you again.
Well, it was a pleasure. Thank you so much.
Yes, goodbye.